So welcome to the virtual open house. My name is Zoila. I am the founder of Public Health Hired. Many of you are here because you know that we are getting hired at Public Health. The name says it all, basically. So I'm so excited for the last 5 years to be helping all of you nationwide, whether you're still a student, recently graduated, or you're a professional transitioning between maybe focus areas or skill sets, or just want to grow and make more money, that's great. I've been able to, help all of you who come to me and try to steward you as best I can. Now, everything that I've done, everything that you see, everything that you share, all of the tools, resources, it did initiate from my own understanding and experience in public health. This was pre-COVID, right? So before COVID, Zoila is a public health professional out there just looking for work. And so in essence, what you see is not only what worked for me, but also what your colleagues, especially those who are getting hired, these right here, the ones that you see, they're the ones telling me, yes, this worked. Yes, this helped. So from the feedback, it's been a tremendous partnership with all of you. Truly, genuinely, you are my peers, you are my colleagues. I love the world of public health. I am so dedicated to this space. I didn't think I would get bit by the bug of public health so hard. But I am, and I love this work. And I feel like this year has been a very testing year for us, but more than ever, it's really shown that I'm dedicated to helping us be successful, meet the needs of the communities, and actually get hired in decent jobs, livable wages, and not have to depend on, just government funding and contract work. There's so much more out there for us, for our peers, and for you. So, with that said, I wanted to just share a couple success stories. I did share Brielle's success story recently. She was hired at Children's Healthcare of Atlanta. She very much is a common story of someone who graduated. I think she graduated in 2023 from Emory and has all the accolades, has the training, has the hunger, has some data analysis under her belt, has even she did like one publication even. She was really trying, but she couldn't figure out, why am I not getting hired? So she decided to sign up for the mentorship. I'll talk more about that in a bit. But she and I met for 8 months one-on-one, and after lots of training, coaching, hard conversations, and rejections, she finally did get hired at Children's Healthcare of Atlanta. And this was a dream job for her, dream company for her. This was probably like this was the third interview within that company. So she had been interviewing for other positions, but this was the third role within that company that she had interviewed. So this is common. I love to share the hired stories, but I also am trying to be more honest with all of you about, there's a lot of pain and rejection and, just it's not easy, right? So I guess it's really nice when you see this slide, like, wow, people are working at Molina, people are working at City Hope, people are working at CDC and CVS. Wow, that's great. But if you really knew what every single one of these logos took, right? The nights of studying, the actual critical thinking that you have to come to the table, it's brutal. And so every single time I know someone got hired, I'm relieved, but I also know that it took a lot for them to get there. So if you feel like, why is this so painful for me? It's painful for everyone. I mean, it's been painful for me. Like, there's no easy way out of this. Alexis is another member of our community. She's been to a couple of our in-person events. If you've met her in person, you're very lucky. She's so amazing, and loves the work of public health and healthcare. She's now at Inland Empire Health Plan, and she actually joined the master class. So a lot of the success stories you hear about do come from the master class. And so she's an example of someone who tapped in, showed up for office hours on a weekly basis. She used up her mentor session with me. She would send me updates or questions via DM and email, and just But she did a lot of interview prep even during group office hours. And then she came back to tell us during group office hours that she was hired. So she's now been working for over a year at Inland Empire Health Plan as a quality improvement facilitator. And then lastly, I was going to share Stephanie. I actually checked in with Stephanie because, as you can see, this is a screenshot of 2022. I do keep in touch with folks who've been hired. This is very common. Once they know that I'm reliable for information or tips or guidance or just what do you think about this, they keep in touch with me. And so she actually let me know that she quit Johnson and Johnson. So as much as I was happy for her to have this job back then, hired at Johnson and Johnson using the hired methods, using how she found the job was through the best practices I teach. How she applied is through the best practices that I teach. And how she interviewed is how she sealed the deal. So she is a very avid community member, but she informed me that she let go of the company about 2 years in. So last year she quit in 2024. It had to do more with her wanting to grow her family. So she wanted to have more kids, and the balance of it all was just too much as a mom. And I had a little one-on-one with her about that because that's also why I let go of my Kaiser job is, I also felt like it was worth slowing down for my family and also focusing more on this community of public health hired. So to all moms out there who are trying to grow their family, or even dads out there who want to grow their family, just letting you know that these conversations of what does this mean and what's best for my family should, always be at the forefront. And kudos to her for doing what's best for her family. But all this to say, she's still like, oh, I'm still like keeping my eye out, and I follow you on job alerts and I'm aware of the jobs. And she had a good experience, but she said just the corporate world was something she couldn't keep up with anymore. So I commend her for getting Johnson and Johnson under her belt. That's amazing. So for those of you who don't follow me on LinkedIn or don't know much about my story, I do try to mention that I have my master's in public health from UC Davis, as well as my bachelor's in psychology from UCLA. I actually just got to go this year over the summer to UC Davis for a career panel. So it was a wonderful full circle moment, to be honest, that I could come back to my alma mater, to the university that, helped me fall in love with public health and share with their students how to get work. So that was really wonderful. But I am a Bruin. I am a Bruin, and I was there for 4 years, and I was in the dorms, and I worked for UCLA as a dormitory supervisor for emergency response back then. And I actually didn't know anything about public health. Um, I was in pre-med. I wanted to be a doctor. I think a lot of us share this experience where we thought we wanted to be doctors. And I did an internship for 3 years at Cedars-Sinai during my tenure at UCLA, and I just realized, I don't love this. I don't really love being in a hospital. I don't want to be in a robe. I thought I did, and I don't. So it was kind of nice just to walk away knowing that this isn't for me. But I didn't know what was for me, right? So I ended up moving to Sacramento where my brother was, and lived off his couch until I found work at a nonprofit organization. So then from there, I started at the American Lung Association. And it is through the American Lung Association and Tobacco Control and Prevention that I basically learned about public health, hence why I stayed in Sacramento and pursued my degree at UC Davis. And the rest is history, where I, quit American Lung Association and then went to the CDC, the California Department of Public Health. And then from there, I quit that job and relocated to LA. And I've been in LA now, oh my gosh, coming up to 10 years. 10 years? Yeah. So it's been about 10 years. And it's been no regrets having quit the jobs that I've had to quit. But all this to say that when the pandemic hit, I was currently working at Kaiser Permanente, and everyone went into social distancing, right? So everyone went into social distancing, and I had no more access. Here's Zoila as a first-time mom. I was a single mom. I had just had my baby. He was a year and a half, and I was not ready to be a single mom in a pandemic. I was definitely ready to be a single mom with an open market of connections. But I was not ready to be a single mom in the pandemic. So that was definitely a lot for all of us who had to just go through that. But all of this to say that a way that didn't let me be so alone, was through all of you. Like genuinely, the pressures of the pandemic and having social distancing and having connections taken away. No happy hour, no lunchtime, no coffee dates. I loved going to get coffee with my friends and my coworkers. And all of a sudden we were working from home and nobody's going to grab lunch. No one's going to grab anything. There's nothing like that. So when you look back, and if you can imagine, here's Zoila as a single mom now working remotely for Kaiser, which sounds great, but I was alone. I was like, this is not cool. Like I was like, I need to talk to people. And one of the easiest ways was, why not just talk to people about how to get jobs? Like that was seemed easy enough for me. I felt like it was low energy, or like low, not even low energy, but I felt like, why not? I mean, there's a pandemic going on. I've been in this industry. I know how hard it is, and I'll share what worked for me. And that's literally what happened is November 20th of 2020, literally, I decided to just host a free webinar, and I told myself I would do it for a handful of months. I was willing to just have free webinars for a while to help people like find jobs and see what else is out there, and give them some hope that they'll be able to land the job that they want. So all of this to say that one of those folks who found me on these free webinars was a previous intern of mine. Her name is Nancy. I've been talking about her a lot lately because she's the one who invested in the company. So she's the first one to pay $500 for 1 month of coaching. And then from there, I just felt, she was like, okay, let's just stay in touch. And I started to open up Instagram. I started to do job alerts. People really followed me because of my job alerts. I had some really cool finds for people. And then I've helped 20 people get hired in 1 year. So from January of 2021 to December of 2021, 20 people were hired. And I was like, wow, okay, something's happening. If in the matter, of a year, my conversations and just sharing tips and best practices actually is grabbing hold, that's when I decided to do the masterclass. So the original masterclass version 1.0, in the intro, for those of you who had it, or if you want access, I'm happy to give it to you, but you basically will hear me say, public health hired has helped 20 people get jobs. So that's how early I was really trying to share the findings and the learnings, was from those first 20. And from there it snowballed. So as you can see, the years have grown. It's been wonderful to hear more and more of you getting hired. I think for me, the goal is always to make you guys feel like your job, your career is literally in your hands. You don't need anyone. You don't need a friend referral or a connection or a favor. What you need is to put your thinking hat on and to really be mindful of how you find these jobs, how you weed them out, how you map them and tailor the job into your resume, how you actually speak to a cover letter correctly, and then how you hold yourself, hold your ground for multiple rounds of interviews. And this is stamina. And the stamina is different for every single mindset. So when you're looking, it's different. When you're applying, it's a different mindset. And when you're interviewing, it's a different mindset. So everyone is aware now that the hired actually stands for something. And if not, then this is what it stands for. So the unveiling of what hired stands for. Now, I'll be 100% honest. I didn't I didn't plan on putting an acronym on it. When the name of Public Health Hired came to me, it was through literally a whisper and from, me thinking like, how do I position this company? So when I had Public Health Hired, it was just Public Health Hired. And then it was more of through the conversations that I realized, wait a minute, this actually makes sense to help us all slow down on honing for the job, intercepting with your resume, reflecting with your cover letter appropriately, with relevant examples, and then embodying the job to actually, speak the language, be the job, and then you talk about dollars at the end. I'm like, "Hello, this is perfect." So I almost just realized from conversation that hired could be broken down into this kind of framework pretty nicely. So again, these things just sort of happened. This was not me forcing the name into this. And now it makes sense because when I work with all of you, when I talk with all of you, I make sure you guys slow down and you're aware of which mindset you're in. Some of you don't even, I mean, I still meet with people who are like, well, I don't do cover letters. I don't believe in them. I'm like, okay, well, then you're never getting hired. Like, without the hired, you're hiding. It's a hide. So there's these things that have helped me keep you accountable on what you have to face. You have to be good at the job search. You have to be good at resume tailoring. You have to be good at reflecting in your cover letter, and you have to be good at embodying the job in your interviews. And then you can talk about dollars and money all you want, but you don't get to do that until you pass all of this. Okay, so this is the secret of the hired method. This is back from 2021 from the original masterclass. This has not changed. This continues to be what you need to hit on in order to get hired. So if you can master this slide, if there was one slide of the entire presentation or of the entire company, it would be this. This is gold right here. This is what has helped me make sure you guys hit your marks, so to speak. If you can hit your marks on every single one, then you will get hired. And that's just up to you to study how to do this for yourself. The masterclass is user friendly for this reason, so that you can understand what these steps are and not take them for granted. Because what we're doing is we're just like tripping over ourselves and doing all the generalities and listening to what our career counselor says and following these other Instagram resume writers, and but yet no one is getting, like, no, you're not getting hired, right? They're more of entertaining your conversations. And I'm not here to entertain your conversations. I am here to entertain you until you get hired, though. Like, I want you to get a job. I want all of you on here, all 7 of you who are on here, to tell me like, hey, Zoila, I got hired, I got hired, I got hired. Okay, cool. Like, keep it pushing. Like, because I want you to be successful, go and actually meet the needs of our communities. This work is imperative. So it's not just for fun. It's like, okay, now get to work. Now get to work. So this is touring. I don't need to do this, but we are touring the community. And part of that is letting you guys know who we are. So I wanted to take just a quick second and remind us that most of the community that follows me does hold a master's degree. Now, if you have a bachelor's degree, great. We still have some followers who have bachelor's degrees. There's less of us who have PhDs, DRPH, just naturally less of us have those. But most of the community has masters. It's not coincidental given that I have my master's, and I've been pushing a lot of us who have our masters to come out of these low paying jobs from like 45, 50,000 to now 75, 80,000. So I think that essentially is one of the biggest things that resonated with my community, is that because I was able to share my story and show how like basically, Nancy, who's the first hired story, she got hired at $80,000 at the American Heart Association. So she and herself, like her story herself, I was able to say, this is possible. Not only me, but now her. So from there, that's why the master's followers, people who have their master's, keeps coming to me. How long have you been job searching in general? Our community is searching for a while. So most of us are 0 to 6 months, and then a few of us are over a year and past the 6 month mark. Yes, it does take 4 to 8 months to get hired. Okay, so just be patient with yourself. But you'll notice that, thankfully, a lot of you are finding me early on in your job search. But some of you are finding me much later and you're like, oh my God, I wish I had found you sooner. I've been wasting all this time. So whether you're in it for a while or new to this, you're welcome and you will find what you're looking for. This is one of the free resources that I've provided to this day is the most, it has been downloaded over 5,000 times and it is used heavily. It is used during your job search, during your tailoring, as well as for your sense making and interview prep. So this is a guide that essentially, again, going back to why Public Health Hired is successful is because it's feedback from you guys. I had a mentee my first year who got hired with her bachelor's degree at Blue Shield. And she wanted to work for infectious disease, but she couldn't break through. And she got a part-time job. Oh my gosh, part-time job working for hand hygiene initiative for Blue Cross Blue Shield. Very cool opportunity. And that's helped her now get full-time work. But essentially, she's the one who told me this. She's like, Zoila, you know what we need? We need like a key. We need like a key or like something that tells us what things mean because I'm lost reading a lot of this. And if you could help me make sure I understand what project management meant or like, you know, what you think advocacy entails or what access to care like I think I know what I mean. I think I know what these things mean, but then when I talk to you, there's more to it. And I feel like we need a key. And essentially, that's what this is. Like, she's the one who put it in my ear. We need some sort of thesaurus or dictionary, some grounding in terminology. And I essentially decided to put forward what I knew the key terms that have helped me be successful in my job search, but also not take for granted. So these key terms is a mix of common terminology, but also terminology that you take for granted or are completely like not aware it's within our world. So terms like technical assistance or even accreditation, like on here, or what's another one that you guys take for granted? Sometimes even stakeholder engagement. You guys don't know how to speak on it. I had one time someone say like, well, stakeholders, that's more for like stocks and finance, right? I'm just like, oh no, dear. No, 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 no. Stakeholders is something you don't just assume. Stakeholders is part of the language of public health. So again, it's a mix of terminology that you may take for granted. Hold on, I'm going to close the store. The garage, the garbage trucks. Um, so it's a mix of terminology. And at the end of the day, people do tell me that the guide helps them see themselves in a different light and challenges their thinking on their skill set and maybe opening up their understanding of what they have to offer. So all of this to say, please take some time to decompress. I do have some really great reflection questions if you're feeling lost and you're still not sure how to encapsulate your experience, especially if you're still in the belief that you don't have public health experience, this is where you need to start. So if you're still like literally every morning I wake up to a DM, someone telling me, I don't have enough public health experience, help me. And so I have to kind of bring them back to center around it's not about the public health experience, it's about the skill sets, focus areas, environments you've worked in, populations you've served, who you've collaborated with, who's been your funder, your scope, breadth, your reach, software, and even language. So it's like a mix of all of this that then says, okay, now I can compete in the job market. So please take some time to decompress because essentially that will roll up into your summary. So this is another thing that has helped our community get hired is the summary. This is also another like like money shot of a slide because a lot of you are still confusing like a summary for an objective and that's not it at all. A summary is really stating what you've done in a different kind of light. And so this has been what has been helping you all get jobs lately is these summaries. So I'm going to jump us to I see we're running out of time and I want to make sure that we jump to some behind the scenes of like the masterclass and making sure you guys are aware of the masterclass. So quickly, I'll just go on the website. So on the website, I usually put like the latest up here, just so you guys know. So for example, this bar up here was today's virtual open house link, but now it's um the November enrollment for the 1 month hired coaching is up here. So if you're always curious, like what's the latest, what's going on, what's Zoila up to, you can always find this button up here. This button sometimes changes to be like 30-minute mentor sessions when I have them open for purchase. Or there's like a workshop that I'm hosting all of a sudden. So you can rest assured that I'm using that button to make sure you guys are aware of the latest. Then I have my two master services is really or signature services, Masterclass 2.0 and then the mentorship. So the Masterclass is really the best deal. What I love about this is that you can actually gift it to someone as well. So I know this has helped you guys, but later when you're making money and as you're meeting students, or if you know of a colleague that needs help, please consider gifting this to them. Again, it's one-time fee. You would just use their email, but then you would pay for them. But it's the most reasonable price that gets you access to online e-course that has the lessons of how you find jobs. That's lesson 101, how you tailor your resumes, that's lesson 102, as well as cover letters, and then how you do your interview prep. And what I've done for this, and then I'm going to be adding salary negotiation before the end of the year. I want to do that. I'm basically going to be doing that again for December. December dollar days is what I called it a couple years ago. I think I'm going to do that again, but I'm going to relaunch the lesson 104 about salary negotiation. But what I love the most about the Hired Masterclass 2.0 is that now I can keep adding hired case studies. So what this looks like is basically you can see someone's you can hear me do interview prep with this person who got hired, but you also get to see the actual job announcement, their total recall notes, their actual resume that they submitted with, and anything else. So sometimes they had an assignment. I think this person had an assignment, so you can see what they submitted. And you'll hear, so you get the full appreciation of like, oh, this is the job, this is what they worked on, these are their notes, this is their resume, this is their cover letter, and this is now me listening to them getting prepped before they actually get in there and knock it out of the ballpark so that they get hired. So I love this because the old version didn't let me package case studies so easily. I actually have two case studies I'm working on. I'm struggling with them because they have like 2, 3 rounds of interviews. And I think you guys have been wanting that. Right now, I've only been able to upload just one video of these individuals, even if they have 2, 3 rounds. But I think the next case studies I do, I'm going to actually be able to edit and slice. And basically, you can see all of the interview prep that they went through, as well as the documents here on the right. So that's kind of the coolest thing about the masterclass is not only do you have the lessons and the practice and you see how I do it, but then you actually see how people are getting through with the exact job that they got or the company that they got hired by. And this also allows me to give you guys updates here. The best that I have for the masterclass is that I've added weekly office hours. So Tuesdays, 9 a.m. Pacific, 12 p.m. Eastern. I'm here on Zoom answering all your guys' questions. I used to, just so you guys appreciate, I used to do 7 a.m. Office hours, 7 a.m. because Zoila had a full-time job that started at 8 a.m. And so I used to even get up early just to try to meet with you guys. And it worked out nicely for a lot of East Coast folks because that would be your 10 a.m. But once I quit my job, thankfully, I was able to readjust the time. So now it's 9 a.m. Pacific, 12 p.m. Eastern. But with that said, because I've been able to quit my job as of last year, I now can do much more with you guys. We do labs. We did all of month of September. We did job application labs where I was helping you guys with state job applications and actual getting feedback on how to do these applications among a group. We even talked about assignments. So, Nick, I think you would have appreciated that one. If you remind me, I might be able to send you the recording of that. Is I walked us through how to do assignments
Okay.
for some of those. Yeah. So,
Uh, Perfect.
yeah. So all this to say that the job application lab is like a way for me to give you guys crash courses or quick practice or working through some meaty, like some more meaty topics. That's where the labs are for. And then I have live masterclass twice a year coming up in January. So where I walk you through the entire lessons for 3 hours. So it's a sitting of how to find the jobs, how to tailor, and how to interview. And I walk you through the best practices. So keep your eye out for January if you want to join me on that. And then I have basically the mentorship. The other service I have is the mentorship. And the essence of that is you basically work with me one-on-one until you get a job. So I just want to make you guys uh, be aware that this is unlike any other service you'll find. So most mentees or most coaches or other career counselors, they have like very specific timeframes for their coaching. So this is unique in that the mentorship is meant to help you get a job. And some of my mentees will be with me for 8 months, 1 year, 2 years. And that doesn't mean we're meeting for 2 years straight one-on-one. Sometimes they life happens for them and they're slowing down. Or I had a mentee who signed up for the mentorship and then she actually was trying to leave her company because she had been stuck there for 10 years. And then she serendipitously or coincidentally got pregnant. And she told me, I've been trying to get pregnant forever. And now that I am, I'm not quitting the company that's been helping me for 10 years because I have all of my accrual and my time here. So she's waiting to restart her mentorship when she's ready. And that happens too. So the mentorship is there to get you a job. That's the goal. If life happens, you slow down or whatever, that's okay. But all of this to say that it is me with you one-on-one. You're in my phone, we're texting, I send you job leads, or I review the leads you send me. Sometimes I'm giving you feedback on what you find. I help you with your LinkedIn, your algorithm. I review your materials and we do interview prep as much as needed. So, for example, recently I was doing interview prep on a Sunday night and she got through, and now we're going to do interview prep again for her coming up soon. So, all this to say that I'm in it to win it just as much as you guys. So when someone joins the mentorship, they're my priority. I want you guys to get hired. And so if interviews are happening, I'm helping you juggle to that. And if you have applications you're doing, I'm helping you juggle to that too. So definitely is a partnership if you want to think of it that way. Now, the nice thing that I've done is because this year is commemorating the 5 year, I've actually opened up the 1 year hired coaching. This is something I haven't offered in a while, and it's because it used to be called Slay. I used to have them called Slay coaching. So it was like 1 month Slay, 1 week Slay, one job Slay, and they were really fun to do. But it started to get really dicey, and I let go of the model. And then I focused on the masterclass and the mentorship. And so this kind of has fallen off like my site. Like it just stopped being offered. I didn't, I wasn't offering time frames of mentorships, but because it was the 5 year anniversary and because the company was founded by Nancy, who purchased the 1 month hired coaching, I thought it was timely to reintroduce it just for the month of November. So if you're interested in getting coaching from me, the way this works is I actually will assign you a Google folder, and you and I, for 1 month, you basically will draft any applications you want me to review for you so that you can submit them properly. You basically will have a folder that says job one, job two, job three, job four. So you just fill in the folder for the ones you want me to review. And on a rolling basis, every Wednesday night and Sunday night, I basically check your folder. So I have mentees already in there who purchased early and they're getting a week free because they're starting early. and I just go in there and I edit it for them and I give them comments, feedback in the documents, and then they submit. The best thing about this, which is why Nancy got hired at the American Heart Association 5 years ago, is that it includes interview prep. Okay. So that means any of the four jobs that you apply to with my help, and if one of those calls you back, your interview prep is included, guaranteed, no additional cost. And that means for multiple rounds, or even assignments, or salary negotiation. So my goal is to get you guys hired, and that is what Nancy experienced back 5 years ago when I helped her with her applications. I said, "Hey, if any of them call you back, let me know, and I'll do prep with you." She's like, "Really?" I'm like, "Yeah, there's just let me know. Like, I want you to get hired." So if you guys want to experience that and what I could do to help you get more callbacks or maybe make sure that you're on the right path, the best thing that I've been able to do is give the current mentees in the 1 month hired coaching, I give them some thoughts to consider about, like, I'm noticing you're talking about your experience this way. Have you ever thought talking about this way? Right? So I'm noticing how they're already limiting themselves. And so it's been nice to coach them not just for an application, but overall their sense making of their skill set. So if you're interested, you must enroll by November 7th. That is the deadline so that you maximize four applications or 4 weeks worth of applications. And just for the low cost of $500, which is the same price that Nancy paid 5 years ago. And then lastly, I have my party. So I'm going to put this in the chat because I want you guys to come to my party. So this is the 5 year anniversary party. It will be at Union Cowork. I wanted to host it at Union Cowork because they actually I had an office there for a while. So they're near and dear to me because I've been a member of theirs. I had an office there. Co-working is something that we need, especially if we work remotely. So if any of you love co-working spaces, I know there's the WeWork, but I love Union Co-work here in the LA area. So if you haven't checked them out, you should. And if you want to check them out, you can come on the 20th and kind of tour their facility. But essentially, they have like an upstairs. I'm going to see if there's any more details. Here we go. There's an upstairs like kitchenette area that is for gatherings, and that's where we're going to be. So you'll be able to mingle and network with your peers and others who are in my inner circle. I am trying to get Nancy, who was the first to get hired by the company, to come, and so I'm hopeful that she will. But if not, then you'll meet me. You'll meet my kids. I want my mom to be there. My partner will be there, and other friends who I've asked to join me, so you guys can meet them too. But that's all I had for today on the tour of Public Health Hire, just showing you um, what I have to offer. And then obviously in the website, you can continue to find the other free resources like the guide that you saw. These are my weekly job alerts. This is pretty much the other best free tool I have is the job alerts. I used to do them much more on social media, um, like exclusively on social media, but now I found a way to just have a Google Doc that just catches every single week. What I love about this and what people tell me has been really helpful is that they know these are the freshest of the week. For example, you can rest assured that the ones I found from this week of October 27th were posted by that company within this week. So if you find old links, like if you click back into September and they just don't exist, that's because they're old. I grabbed them from the company website, right? So it helps you see what's being posted and is actually fresh instead of not sure if it was posted like a month ago. So that's one of the best features of the way that I do job alerts. Questions? That's all I have for now. We're